Okay, I'm excited to welcome back to the chicken webinar, Rebecca Moore. So Rebecca founded and runs the Institute for Animal Happiness, a chicken microsanctuary and vegan organization in the Hudson Valley of New York State. The Institute recently produced and moderated Avian Influenza in New York State, What You Need to Know, which was an educational online forum. And she has recently contributed an essay to the book Vegan Voices, edited by Joanne Kong. The Institute also produces Hudson Valley Vegfest and runs the Happy Cart, a 100% free vegan food program in collaboration with People's Food Place Food Pantry in Kingston, New York. She can be found 7 days a week, cleaning coops and caring for the residents of the Institute, and fully believes chickens can and do inspire revolution. Rebecca, I'm excited to have you here.
Thank you. And I guess share screen, so I'll get I'm so happy to be here, everyone. So I do share screen, right? Oop. Oops, you'll let me know. I think, don't I usually get a little message?
So it should just be able to use the green share screen.
Oh, can you see it?
Not yet.
Okay. Oh, it's not letting me. I'm doing share screen. It says disabled.
Sometimes there's a second step where you see your desktop screen and you have to click on that.
Oh, interesting. I'm looking. I'm looking.
Alistair, do you have any advice?
It's okay. Brian, you don't have to help. This isn't me. I think they have to be. Huh. It's disabled. Sorry, folks.
Let me see. Well, let me check one thing.
Yeah, I've done this before. We've done this before. Thanks, Brian.
Okay, here we go.
Yay.
Okay, give it a try.
Oh, there we go. Yay.
Sorry about that.
Yeah, below.
Zoom settings can be kind of wonky sometimes.
Making me open preferences for something. Yep. Okay. Sorry. Oh, brother. Hold on. Okay, hold on. Zoom will not be able to record the contents of your screen until it is quit. I'm sorry, folks. I've done this before. Is this because of an update of some kind?
I'm not
Oh,
sure.
there it goes. Okay, now it's doing it. Don't know why that took that time. Here we go. And then present. Sorry, folks. All right, so here we go. I don't know how to move this away. There we go. Thank you for having me. My head is swirling with everything I just learned. And of course, it goes without saying, Alistair and Karen and Hope, I just have learned and admire these folks so much that it's kind of overwhelming to be here. It really makes me proud to be learning and sharing this work with everybody. So that said, I'm here today to present on avian influenza, and I called it an overview of history, care, and activism in a time of challenge. To be honest, I'm learning so much about this as we go, and it's such a loaded everything. So I'm not necessarily going to be touching upon biosecurity today. Very, very briefly, I really recommend the Open Sanctuary Project website for that. But, we'll see how we go, and if there's questions at the end. If I don't cover something, just know that I'm finding my way through the subject myself. So to go forward, here we go. So starting with a historical overview, and this is a photo, an Army hospital in Camp Funston in Kansas in 1918. That is because the 1918 flu pandemic was, avian in origin, but that's actually a very simplified understanding of that pandemic. And most of what I'm going to be talking about is what affects us, the birds, and us as activists in sanctuaries. So I created a basic timeline just so we all get to learn about the history of this disease. So basically, an avian influenza virus was first documented in approximately 1877 to 1888. That is so long ago in northern Italy. And that was the first, now we know, recorded documented cases. But unfortunately, they didn't have the tools to know that that was avian influenza. They called it fowl plague because the only other illness for chickens at the time that they understood was called fowl cholera, and some symptoms were the same. But cholera is from tainted water, and it clears up when you put, you know, clean water in, and this was not having that same effect. So, so here we go. From 1887 all the way through 1954, a number of HPAI, highly pathogenic avian influenza events occurred throughout the world, but there's not a lot of, you know, documentation of those events. I don't know how many birds, I don't know how, you know, who was affected. But by the time we get to 1918, so this is really a critical point because suddenly we now know that this was an avian influenza occurrence that passed into the human population. The current avian influenza virus that we have here in the United States now and around the world is not H1N1, it is H5N1, and H1N1 goes human to human. H5N1 really is not as dangerous, but it has, one person has in the United States contracted it, but I'll try to lay out more of the differences of that. So just to give you a sense though of this 1918 flu pandemic, which was originally very problematically called the Spanish flu, just because there was a news blackout on discussing it in the United States. So the Spanish media was very open about it and doing tons and tons of coverage. So if US residents and Americans wanted to learn about the pandemic, they were going to the Spanish media and trying to access that. Interestingly enough, the Spanish called it the French flu because they thought it had originated in France. So that's, I just bring that up because there's so much stigmatizing, there's so much racism, there's so much human messed upness in the way we look at these illnesses. And of course, with COVID, we saw, you know, how that got labeled, you know, after, you know, a country instead of, you know, sort of looking at the virus itself. And so 50 to 100 million people died in that pandemic. And we say 50 to 100 because it's documented around 50, but most scientists who study this disease are pretty sure that many, many more got it. And because it wiped out whole rural villages and things like that. And this happened only over a 16-week period. And it was 675,000 deaths in the United States alone. It's also interesting to note that almost all scholarly accounts after years and years and years now point to that pandemic having started in the United States at a military base in Kansas before it moved to Europe and Asia. And for me, it's like, well, that made me think, what do modern industrialized farms and the military have in common? A lot of living beings crowded into very minimal living conditions, very crowded living conditions. So there's a lot of just sort of parallels going on from, I don't know, the way we have continued to breed animals and sort of the way we treat each other as humans and have less and less space also as humans. So the pandemic then was devastating. It was taking out, like I said, whole rural towns. And it's also worth noting that it's hard for us to understand the devastation of that, but the population of the entire globe was 23% of what it is today. So that's, we have quadrupled, you know, in the number of humans. So that loss was felt by everybody. And it was until COVID sort of this, for the globe, you know, a real pandemic. So by 1955, we finally had the tools to determine what had been called fowl plague was actually type A influenza and avian in origin. But that's not so simple, so we'll circle back to that as well. The there was an outbreak in 1957. By 1959 to 1995, the emergence of HPA viruses was recorded on 15 occasions, and it was in the avian population, but there weren't major, losses of birds. It was tempered because people weren't doing like industrialized farming was just sort of taking off in that time frame around in the 1950s is when it really amped up. So there was an outbreak in 1968 there, and from 1996 to 2008, HPAI emerged 11 times, and four of those emergencies involved millions and millions of birds. Then the outbreak before today, 2015 to 2016, was the last very large outbreak. And in the United States, over 50 million birds were culled, ruthlessly culled, as they are now. So that's like this history. Where we are today, I'll read this quickly. This is H5N1. Again, it's not H1N1. So this isn't typically circulating from human to human. It has spread to over 60 countries. It has caused the deaths, mostly by culling, probably, but also the disease itself, of hundreds of millions of birds worldwide. It's affecting all the different members of the poultry community, but domesticated waterfowl, chickens, and turkeys are the most vulnerable. We're starting to see an historic and unusual rise with this outbreak in wild raptors, wild birds succumbing to H5N1 as well. And that is very unusual. They were previously only deemed to be carriers. And sadly, it was just announced in May of 2022 that wild turkeys were found to be carrying HPAI as well. Also concerning, for the first time, the disease has passed into the wild mammal population. So it's taken the lives of 6 wild foxes, 1 in Japan, 3 in Michigan, 1 in Minnesota, and 2 in Ontario. That's just as of yesterday. Certain breeds of seals are also susceptible to the virus as well. And I end with 1 human has become infected with H5N1. And of course, that is very concerning, no doubt. So here is a slide that is from the CDC website. And as you can see, that this was actually as of, a week ago, May 14th. So we were up to, the losses are so astonishing, and nobody blinks, 37, 38 million birds. You can see here that there are, a little over 1,000 wild birds have been detected with the virus. And of course, that figure has got to be much more. In fact, they think it has passed into the fox population, those foxes that had it, because they may have found a bird that had passed from HPAI and ingested that bird, eaten that bird, and then that's how they got the virus. So, these are just the ones that people find, but so many probably died, in the woods. But look what happened just a week later. So this is now, as of May 20th, it went up 200,000. So we're not hearing about it in the news every day. And it just seems like nobody blinks if 1 million birds are culled, right? But here we are going up these astonishing, insane numbers still. And it's just not in the news, you'd think this is a major calamity, 200,000 beings dying. So it's something that's really upsetting, the speciesism about, how we look at chickens, especially, and all, non-humans and farmed animals. They're just commodities, as we all know, as activists. The 2 more states ended up having wild birds detected. We only went up 1 state, from in the week, and the number of human cases, which I am suspect of too, because the symptoms are very mild. The 1 person who did get it was working at a factory farm and had been doing the culling of the birds. So I've got a cat on my lap. I'll keep going. Global bird populations are steadily declining. And this was an article that just came out a couple weeks ago, but I noted it because, you know, it isn't mentioned HPAI in here, but they're just talking about the staggering declines in wild bird populations, loss and degradation of natural habitats, direct overexploitation of the species, climate change, and those are all drivers of increasing zoonotic illness and you know, the ability for these viruses to mutate is being amped up by those factors as well. So there's just sort of like, you sort of have to be a detective reading these things and sort of start understanding how these things all connect. I put this slide in because this, when I said before that saying something is avian in origin it's so simplistic, but this is from the journal Nature, referencing the work of Michael Warabay, an ecologist and evolutionary biologist at the University of Arizona. And he said, a 2005 genetic analysis of the 1918 pandemic virus pulled from the victim's preserved tissue concluded that it most likely matched viruses of avian origin. But a 2009 study found instead that the viral genes circulated, and this is so key, in humans and swine, pigs, for at least 2 to 15 years before the pandemic and combined to make the lethal virus. So in educating ourselves, we need to understand, you know, that this is not something you can just blame on one species or one animal or one being. The way these viruses mutate. So in this case, that 1918 virus, it existed in an avian at one point, like so many things live in wildlife, you know, that humans never come into contact with. But then it gets into a human and it's still not a problem. But then that human is farming pigs, and then that virus jumps into a pig and back into a human and back into a pig and back into a human, circulating for 2 to 15 years, still as something innocuous and maybe not taking any life, before then it jumps back into a bird, and before suddenly that virus has found the right, you know, genetic combination to change and become something very dangerous. So it's important to understand this stuff. I guess I really am learning a lot that I did not know in so many years of caring for chickens. So what I wanted to talk about today is sort of, now that we're all in the midst of this quote unquote outbreak, this global outbreak, there's a huge effect on all of us who do any kind of care, rescue, advocacy. And let me find my right note here. There we go. Number one, I'm going to just start, and because I want to address everything, like psychological stresses on all of us who do this work. There's so many things pulling us every which way that, you know, we want to fight the stigmas against these birds. We also want to use this time to educate and be activists, but we're facing all this stress just in the immediate present, trying to give care. So these are some of the fears, you know, I just sort of asked community, what are the fears you have? And these were expressed by people I talked to. Fear for residents' well-being was always, of course, at the top, and their safety, that the residents, your chicken friends could get sick despite your best efforts. The lockdown effect on residents, their psychological state, being able to keep up with enrichment. A lot of people were not prepared because they never saw something like this happening in their city or town, and just the physical effects of not being able to allow the birds to have their foraging time, their interaction time as much with others if you didn't have enclosures that allowed that. Stresses amongst sanctuary community as colleagues disagree with how to uphold protocols or messaging about the situation. I'm hypersensitive to that stuff. I'm always afraid I'm going to, you know, say something that is not politically correct in trying to express a fear or a concern. So I'm learning through this whole thing. Infuriating headlines are very stressful. Just reading the news as activists about this, it's I can't tell you how many headlines like this I had to sift through. And it really, just like being vegan in a non-vegan world, it sort of just makes you feel so hopeless. Like this is all people care about when we have this really major thing happening that is devastating, the chicken community, turkey community, and the duck community, and just this continued alienation I think we feel as vegans and vegan activists doing this work. There is also minimal education in the community. So I did a forum on avian influenza because this is the Cornell website. And I went to the Cornell website, Cornell Ulster, trying to find avian influenza, information. And I saw gardening and profitable meat marketing, their 4-H golf tournaments, just about everything except that was the front page. Where is it? So I scrolled a little more, COVID resources, crop production, livestock, keep going. Down at the very, very bottom corner of the page, finally they had avian influenza information. And of course, the first thing they're saying is just report it. And they're not really educating people unless you go to these little links, but there was nothing, you had to dig for it. And it also was incorrect because they finally changed this to say that one human had gotten it, up until I had to go to their Facebook page and tell them they had incorrect information. So this is the body, right, charged with protecting everyone, including their industry folks. And this is how they're doing the job. So it's really disheartening. This is Deborah Davis of Blueberry Lane Farm with her friends, and they're in lockdown. And she shared this picture with me. And this comment, I asked folks what their concerns were. And Deborah said, our future will now include building differently and having quarantine procedures against the avian flu. It's so exhausting, and I try not to feel the disregard for humans and greed. The roosters are my heart. Anissa Matheny from Mother Clucker's Microsanctuary. These are her photos of her sanctuary friends. And she wrote, what's really sticking with me right now, I guess, and making me feel more hopeless is how climate change is playing a role. Birds migrating together who never did before, and migrating to different areas they never have before. I listened to a Zoom interview with our state vet, and it was really depressing that this is something that just seems is going to be a part of our lives now. And in fact, it always was actually a part of our lives, but we didn't feel it. Like I would hear of outbreaks in other places. And to be honest, I was so much worried about so many other more quote unquote immediate things in my area, but it is, feeling pretty weighty now, like this may not go away. Jamie wrote something that she enlightened me to something I had no idea about. For some reason in all my article reading, I hadn't come upon the conspiracy ones, the conspiracy articles. So now I've read them, that apparently just like with COVID, people don't heed recommendations because they think it's government led. I think she means created, and it's a dangerous thought. And it really unnerves me with the thought of having guests to our farm, because people can really bring the virus, like visitors, to your area. So, just fielding the community to hear their fears. This was an urban chicken and waterfowl rescuer, and a few communicated the same thing to me, saying they'd always struggled to place chickens, turkeys, and ducks that are rescued in urban areas in any safe forever homes, even on a good day with no HPAI. But now it's just even harder because not all sanctuaries have HPAI biosecurity protocols. They don't have the enclosed or fully covered runs. So, this was expressed to me, and I can only understand when your job is in a city area and you're coming upon, chickens and ducks, and you can keep them in your apartment for only so long. But finding good homes now is just harder than ever. So with all that was the stress sort of on the sanctuary community and the caregiving and the rescue. There's also stress for all of us on resources and funds. So many people have experienced a loss of volunteers, that needing to increase staff or pay overtime. We now have to have, at our little micro sanctuary, 2 people doing the same job that one used to do, because you don't want tools put down in the wrong place, or not something if you neglect to disinfect something. So it's doubled our overhead in that sense. I mean, we're very small, so we feel it less than I'm sure others do, but there's a loss of visitors. There are many organizations that did rely on having visitors come and give donations and meet and see the work being done. But of course that under the best circumstances, that really shouldn't be happening now, because again, HPAI it's traveling around, and it's on car tires, it's on people's shoes, so you're really helping the residents out by not having visitors. Loss of a space due to stigma if one is renting or moving with birds in your care. This is a personal fear that I had to put on the list, because we have to move in the year ahead. And I have these moments where, as we start to look, that it's going to become an issue for someone that HPAI, and they don't want a chicken rescue near them. It hasn't happened yet. Never know. So here are some of the supplies we've had to buy. And I'm not doing full on biosecurity talk here, but just to give a sense. So we got the disposable boots, and again, these were things we had on hand in small amounts just for certain things. And now it's like in every coop has a boot station, disinfectant, a boot cleaner, though we've actually eliminated the step-in boot soaks, because that's apparently not so effective. They do look something like this. So I don't know if you can see my pointer, but you step into the gray bin, you take off your boots in there. Then in this yellow bin is a clean pair of boots that you put down on the straw. You can sit using the seat and put on those boots. We have disposable shoe covers if people do need them, but we're trying to reduce disposables by using the reusable boots that are quarantined. Signage, disinfectant, tools that now stay in. Like we used to have them hanging on the outside of the coop, but now they are inside. So little things. This is, what we can afford to do. We have the covered runs now that you see there. And this is Mother Clucker's microsanctuary. You can see the plastic, which is terrible, because today we have our first hot day. And I can't wait to talk to people, because I need to learn how to keep them cool. I had to open up the plastic on our coop so it didn't become a greenhouse in there. And we also usually employ battery operated fans, but it occurred to me that might blow what's called fomites in, which is, the material matter that dust, sand, whatever that carries the virus adheres to. So right now we haven't installed the fans until I can get more information on that. So that's, kind of, a glimpse of the biosecurity that can be done in a small micro sanctuary. We're also facing physical limits of energy and of our facility, and many people are. So literal physical stress from having to uphold more work if you lose volunteers or staff. Facing potential extra limitations of your space due to any extra situations that would require quarantine of more residents. It's definitely stressful if someone looks sick and I want to bring them in. But how I was operating before, which I thought was, level A micro sanctuary, we really have a small space and we don't have a lot of quarantine space. On a good day, how we typically operated was birds would do their quarantine at an external location, new birds coming in, they get all checked out, do their quarantine, then move to us. But all of this is changing, and we're changing what we know every day based on what we read. So I wanted to plug Open Sanctuary on this slide, because they really, if you need to get in depth on biosecurity, that is the place to go. They're so wonderful, opensanctuary.org. And then, of course, there's other resources, and all of us are willing to share if you ever want to message me. But I've learned everything from them and just from, talking to others. So that's Kevin. How do we talk about this? How do we keep talking about this or not talk about this? And Kevin doesn't want to be scared. I don't want to stigmatize anyone. Our goal is to encourage people to want to do rescue, want to create havens for these birds. So if we talk about our fears, maybe we can frame the concerns as thoughtfully as possible. That's just one thought I have, and I'm open to suggestions, but we definitely don't want to stigmatize the birds themselves as much as possible. And I'm open to advice on how to do that. We need to keep non-human centered in a way that continues to empower them and be positive, and as much as possible, they are not the instigators of this. Humans are. We need to center the vegan ethics and information wherever possible. So I think you can go out and do your activism and discuss things, but everybody has a different idea of what that means. I'm going to show you one way I think we've slipped up a bit and then tried to self-correct. This was our graphic for the Avian Influenza Forum that we held. We rushed to do one, and we were the first in probably New York State to do a public education forum, because I saw nobody else was doing anything. But my wonderful board member made this graphic and we utilized it. And then later I thought, looking at it, I was like, it's a little, looks like a warning sign, it looks a little stigmatizing. Orange is my favorite color and I use it everywhere, but this was like, just looking a little like a danger sign or something. So I redid it to feature little Percy, being cuddled, held against someone lovingly, brighter colors, just trying to not add to the stigma wherever possible. And so in our graphics, we can maybe make this less about, danger, a bird, and more about care and sort of caring about humans and non-humans for that matter. So that's, sort of the beginning of the stigma talk. And again, this is just like an overview of a lot of thoughts I had going through my head. How can we rise? Almondine, Blanch, and Hall want us to rise through this. And they want us to, be able to continue to advocate. So one thing we can do, which came out of the forum, is maybe we can advocate for vaccines to be released. They do already exist. So obviously this is a Band-Aid. This isn't solving the issue. But the text below here that's from Dr. Jared Jagny, one of the highest Cornell vets. And this was their response when asked, is there a vaccine? And they did say, H5N1 is zoonotic, which means humans can get it, but tell people that vaccine is not available for commercial or backyard poultry. Some countries do vaccinate, but not the US. And up at the top, the US has a policy of not vaccinating, but will instead depopulate, because vaccination with AI will allow chicken importing countries to reject US exports. So that says it all. The power of this industry they even know it's zoonotic. They know it can jump to a human, but they're not willing to help birds be prevented from getting it because it would destroy profits. And this is so sobering. Few industries have that much power. So we can get the message out. That's another thing we can do. This is pandemicfreeworld.com, which we worked on in partnership with our friends, New York Farm Animal Save. This was at the beginning of COVID, but now we have found that because scientists say we are entering an era of pandemics, we've been able to adapt the site and have it work for HPAI on behalf of chickens and turkeys and ducks as well. So we now have a page of links and info on that. And these billboards, there was like 5 of them. Billboards are surprisingly actually affordable if you feel like doing one, and if you feel like you can get a message that really encapsulates what you want, some kind of root message. If a few people can go in on it and get a billboard, and I'm not experiencing from these corporate, billboard places any resistance to the messaging at all, which is amazing. This was Long Island Orchestrating for Nature, a group, humanelongisland.org. And they did a billboard campaign that I actually was intrigued by. I liked the wording of it. I know that some of these things can stigmatize the birds as well. So I'm interested in your thoughts on that. But what I appreciated was they did link exploitation and breeding as being responsible for disease, not animals. So that none of the stigma or the fault is put on animals in this particular messaging. And they did like 5 different lines. So we can also continue to engage in community hubs. So here I am on the Cornell site, and I have my timer going here. Hold on, I'm gonna keep it going to, I have a timer to make sure I don't go over here. So I went to the Cornell Facebook page, and they still didn't have an update saying that a human had gotten H5N1. So, and as you can see, that this post was on March 1st. We're now in May. They have not posted on HPAI since then. It's just sort of astonishing. Like, it just doesn't matter to them. Tonight we have discussed the science and this, and how I'm going to pause this. This was Speaking Truth to Power. So in our forum, and you can organize this. Zoom makes it possible, and get together with friends. We got wonderful Tara Hess from Open Sanctuary Project, Miriam Chisholm from New York Farm Animal Save, and this is Amy from Cornell Ulster, and she's a head avian educator there. And we did a whole sort of, we invited them in, and they came, and they really got to hear the sort of pain of the sanctuary and vegan movement trying to deal with protecting birds. And we sort of let them know in this forum with, in no unconditional terms that, we felt animal agriculture, from all the science, all the evidence, and we presented it, is creating this situation of these mass deaths of birds and threatening human health, and that we were, not going to let that continue. And it was amazing. They're ghosting me now, but they came to the forum. What is ahead? So, going through all of those things that are affected, operations, activism, what does the future look like? And the UK recently ended their lockdown phase. So if people are watching this that have sanctuaries and are wondering how long this is going on, we're in for a long haul, depending on where you are, but you really should expect about 7 months. The reason for that is because an area is not deemed safe unless they count 120 days from the last report. So if they go 120 days, which is a long time, right? 4 months, or 3 months, you are trying to keep your birds safe and all that time, there's going to be no clear cutoff point where you go, okay, it's done, everybody's safe. It's not going to feel like that. It's going to be a chance. And then on top of that, so we wait all that time. Let's say they do make an announcement going, it's been 120 days, but what the problem we're facing here, at least in our area on the East Coast, is that they expect it when it cools again, because the virus actually likes cool weather, and there's a reverse migration in the fall. They sadly expect it to rise up again. So I don't have any good news there. I think this is a big conversation that sanctuaries and rescues, we're going to have to support each other, and we're going to have to talk if we want to continue this work. We're going to have to maybe build differently. We're going to have to innovate enrichment more. We're going to have to keep innovating our care and our advocacy. And, I think microsanctuary movement is really important. And so everybody should follow Alistair and Roz and Microsanctuary Resource Center and Triangle Chicken Advocates, because the whole microsanctuary movement is so critical, because I think doing things small is going to make it safer and healthier for the birds, because it's going to get harder and harder for us to manage space, manage finite resources and space if these illnesses keep rising. And by all accounts, they're probably going to. We've got to use this time to control the narrative, to self-educate. We've got to connect to our communities. I think we've got to help people make connections about human and non-human health and well-being are intertwined, but always, you know, making speciesism part of our education. And I think putting non-humans, elevating them, putting them first a lot of the time and elevating them in the conversation to try to work against the stigma, to try to make the change we need. We want to end animal agriculture because animal agriculture is such a main driver of these kinds of illnesses proliferating. But for now, I think we have a future, and I'm sorry to end on a sort of depressing note, where we have to understand the reality of this situation and understand biosecurity. So that's pretty much it. It's really a huge overview. I have some links there where I did some research, but I'm still doing research every day. There's just too much to know. So thank you. And I'm going to stop the share now because I can't see anyone.
Thank you so much, Rebecca.
Thank you.
Fantastic. Yeah.
Yeah, thanks, Rebecca. Yeah, no, if I could just chime in real quick. Yeah, no, I think the points you made at the end are very interesting. I'm speaking obviously from the microsanctuary perspective and also from operating a sanctuary. And I mean, one of the things that I think has come up with this, because this isn't the first time that avian flu has been an issue for sanctuaries. And, you know, like different strains move through at different times and, you know, some are more concerning and others are less concerning. But, you know, I think one of the things that we probably know if we're aware of like issues related to climate change is that diseases and pathogens are, you know, going to become a more and more of an issue. And I think it's interesting to think about like, not just like we have this majorly like bad variant moving through this year, but also kind of like what the future is going to look like every winter now going forward. And yeah, I mean, I think like the conversations we're having now, like, you know, are really important to start informing the ways that we think about the years going forward. And, you know, hopefully like one of the things I love about the microsanctuary community and things like Open Sanctuary Project, which we're going to hear from shortly, is the way in which like we're trying to pool knowledge and resources. And like, you know, I think new innovations and kind of approaches to design and biosecurity are going to be really important going forward. Because like, you know, we're dealing with hot weather down here in North Carolina now, and our birds are still all inside, and, you know, everybody's got to deal with different issues that have arisen from this change in kind of the norm. So yeah, it's a really important conversation. And Rebecca, I'm really grateful for you putting so much energy behind this, because I think all of the sanctuary world is going to need to be talking about this more and, you know, starting to think about things a little differently going forward.
Yeah, I didn't want to be a downer. It's really sad to go. There's also, I want to encourage people to do this work. I really do. And the beautiful thing about microsanctuary work is that doing that small scale care makes it easier to keep them safe and easier to keep them happy and easier to give them space. And when more people step up like that, you know, I think that is actually a key to us continuing this work with this kind of a virus passing through now. And I meant to point out, I don't think I did, when I did that timeline, and you see how the cases of avian influenza amped up by like, 2000, well, it was like 1995, but that was all like from 1959 on is when factory and industrialized farming really, really amped up. But we don't just blame factory farming and industrialized farming, because I wanted to show that this has existed, going far back, but it has amped up and become a real problem as industrialized types of, as we start to farm more and more and more animals. And so there is a correlation. And so we really have to chickens, roosters, hens, they will always need a place to land. They will always need safe haven. We as activists have to learn, how to operate. I'm not going to give up. I'm totally going to learn how to beat this, because I do not intend to stop helping these birds.
Wonderful, wonderful. Thank you, Rebecca, so much.
Thank you.
We're going to take our 5-minute break now. That was fantastic, such great information.